As we get the upper hand on the COVID-19 virus, doctors worldwide can now concentrate on the long-term side effects. So far, we've told you about brain fog, fatigue, hair loss, and a whole segment of people with multiple symptoms that just don't go away. So in this special Health Watch report, there's growing concern about a lingering and annoying impact on your hearing.
I never had a fever. I never had a cough. I never lost my sense of taste and smell.
Sherry Petta's COVID symptoms were fairly mild, but within days, there was one severe symptom.
My whole body is buzzing. I'm buzzing. I feel like I'm electric. My ears are ringing and my whole body is buzzing.
A certified child life specialist, Petta works at a hospital. So when her ears started ringing, her brain and her gut told her it was COVID related.
And what's going to happen to me? How bad is this going to get?
It's this new onset, bothersome, high-pitched ringing sensation.
Dr. Michael Kubala is an ear, nose, and throat surgeon in North Texas. He's seen plenty of patients with tinnitus related to COVID.
Some are just mild symptoms, but some are, even severe enough to produce anxiety, depression, sleep deprivation.
In March, the ringing got so paralyzing for Kent Taylor, he died by suicide after experiencing unbearable post-COVID-19 symptoms. Taylor was the CEO of the popular restaurant chain Texas Roadhouse. His struggle made national headlines.
Those studies show anywhere between 5 and 15% of patients have the tinnitus after their infection, and anywhere between about 3 and 8% may have permanent or sudden hearing loss.
So even though there may be a small amount of sufferers nationwide, the impact on their lives is huge.
But this electricity, this ringing of the ear, that started in October and now it's May.
I think I got really teared up the first time somebody told me get used to it, because I was like, I cannot imagine just trying to get used to this. This is crazy. It's in my head all the time.
There's no, magic treatment to get rid of it.
It never seems to go away. So doctors suggest masking techniques like white noise, meditation, even counseling.
Something called cognitive behavioral therapy, which is essentially like psychology, counseling to help essentially retrain the brain on how to respond to these noises.
For this active wife and mother of 2, tinnitus is part of her new normal.
Sometimes it's very loud, sometimes it's quiet, and I really don't notice it. I believe it's always there to some degree.
So if you or maybe someone you know is suffering with ringing or hearing loss, doctors urge you to get a hearing test. Now, studies are underway really across the world now on how the virus impacts your hearing. But at this point, there's really no definitive way to treat it and quiet that buzzing in your head.